Assalamualaikum. My name is Muhammad Ali Haider, and today I will be delivering pharmacology lecture number 7. Um, Drug body interaction. The interaction between a drug and the body are conveniently divided into two classes. The action of the drug on the body are termed pharmacodynamic processes. The principle of pharmacodynamic are presented in greater detail in chapter 2. These properties determine the group in which the drug is classified, and they play the major role in deciding whether that group is appropriate therapy for a particular symptom or disease. The action of the body on the drug are called pharmacokinetic processes and are described in chapter 3 and 4. Pharmacokinetic processes govern the absorption, distribution, and elimination of drugs and are of greater practical importance in the choice and administration of a particular drug for a particular patient. For example, a patient with impaired renal functions. The following paragraph provide a brief introduction to pharmacodynamics and pharmacokinetics. Pharmacodynamic principles: most drugs must bind to the receptor to bring about an effect. However, at the cellular level, drug binding is only the first in what is often a complex sequence of steps: drug plus receptors minus factor, drug receptor factor complex effect 2, D plus R, drug receptor complex is equal to factor molecule effect D plus R into D minus R complex activation of coupling molecules, effector molecule affects inhibition of metabolism of endogenous activator, increase activator action on an effector molecule, increase effect. Note that the final change in functions is accomplished by an effector mechanism. The effector may be the part of the receptor molecule or may be a separate molecule. A very large number of receptors communicate with their effector through coupling molecules. Type of drug-receptor interactions: agonist drugs bind to and activate the receptor in some fashion which directly or indirectly bring about the effect. Receptor activation involves a change in conformation in the cases that have been studied at the molecular structure level. Some receptor incorporates effector machinery in the same molecule so that drug binding brings about the effect directly. For example, opening of an ion channel or activation of the enzyme activity. Other receptors are linked through one or more intervening coupling molecules to a separate effector molecule. The five major type of drug receptor effector coupling systems. Types of drug receptor interactions: pharmacological antagonist drugs by binding to a receptor compete with and prevent binding by other molecules. For example, acetylcholine receptors blockers such as atropine are antagonists because they prevent access of acetylcholine, and similar agonist drugs to the acetylcholine receptor site and they stabilize the receptor in its inactive state or some state other than the acetylcholine activated state. These agents reduce the effect of acetylcholine and similar molecules in the body, but their action can be overcome by increasing the dosage of agonists. Some antagonists bind very tightly to its receptor site in an irreversible or pseudo irreversible fashion and cannot be displaced by increasing the agonist concentrations. Drugs that bind to the same receptor molecule but do not prevent the binding of agonists are said to as act allosterically and may enhance or inhibit the action of agonist molecules. Allosteric inhibition is not overcome by increasing the dose of agonist. Thank you very much. Till next time, I will be delivering more lectures. Take care. Bye.